support that we heavily rely on here in the country, and that is with HIV, TB, malaria, and maternal health, like you've mentioned. But we also do understand that transitioning also require, a coordinated support and engagement. Right. So what are you doing as the embassy to ensure that there's no interruptions? I know you've said that there will be a report that will be released very soon, but what are you doing to ensure that even as this transition is taking place, there is no interruptions with regard to how we are getting funding for HIV, TB, malaria, and maternal care?
We have the large, like our Centers for Disease Control, the CDC, their largest office outside of Atlanta is here. PEPFAR, so I've spoken with some of the leadership at our embassy on that one, and they said, like, for example, that the drugs, they continued throughout. They were not pulled back, and those will continue. But I think there is more of an emphasis from President Trump on sustainability. So trying to make sure that at some point the local partners, the local governments are able to carry on and sustain these programs long term, because it isn't, foreign assistance was not meant to be like an infinite. The goal is to try to help the partners stand on their own 2 feet, and Kenya actually has a very good health system that's improving. There's a lot of dedicated doctors and different levels that are working on this stuff, but I think there's more of an emphasis on ensuring that these can sustain long term. So wait for coming days. We'll have more information on what this is going to look like. But there's a lot of work going on right now with both Kenya and U.S. officials here and in other parts of the continent to make sure when these are unveiled, that there's going to be a strong, and in the end, Kenyans will benefit from better health care. And Americans benefit. I mean, President Trump made, he says America first, right? But the thing is, these like pandemics don't respect borders. So if there's a problem in Kenya, if there's a problem somewhere else in the world, it can also reach the U.S. So this protects both of our countries. So that's what we're trying to find, is a way that we can help Kenyans, we can help stop pandemics by working together. We're not stopping this. We're saving lives, and the U.S. has invested more than $7 billion in Kenyan healthcare in the last 20 years. I think that's something in the range of like $1 trillion shillings. It's a lot, and we're not going to step back and let that disappear. It's a very important investment for us. It's a commitment from Americans to help a partner. We view Kenya as a partner, but Kenya is also capable of doing more, right, with the system. So it's President Trump, I think, wants to see capable partners take on those responsibilities that we were doing in the past, but they're absolutely going to be continuing.
So do you see an instance where Kenyans, we are able to stand on our feet and not rely on donor funding? You say that we have very strong health systems, which is improving day in, day out, but with everything we've seen, how just by reporting about the US aid and how some of the benefits were withdrawn, it got the country, it gave us a lot of jitters, and it got us talking. So do you see us getting to a point where we do not really have to rely on donor funding? I
mean, that's the goal. I think it's important to note that there are, we read the press here, you guys report on the shortcomings of the health system, and that people who have complained and criticized it. That's not for us to say, but I think it is important to take a step back and look at where you were 25 years ago versus where you are now. I wasn't here then, but I've heard stories on the number of deaths, people dying of AIDS, people dying of diseases that are now prevented. The health, like millions of lives in Kenya have been saved through these advancements, and it has gotten better. There's a lot of advances in Kenya. A lot of it's through our partnership, but the system in Kenya has improved over the last 25 years. There are a lot more people alive today who would have otherwise died from these diseases. I'm told from former diplomats, friends from Kenya here, that 25 years ago, the largest industry in parts of Kenya was coffin making from people dying of AIDS. Trying to prevent children from being raised from single parents because the mother or father died. I mean, that's, I think we're very proud of the fact that we have saved a lot of lives in Kenya. And now I think there's more of a focus on ensuring that Kenya can really take control and does more. And I think it's not an overnight, it's step by step, but there's a lot of dedicated health professionals here who are capable, and I think the emphasis from Washington is a bit more on ensuring that sustainability and partnership. And eventually, I mean, you know, every country should stand on its own 2 feet.
All right.